Welcome to Hemp Foundation Talks, where we listen to the heartbeats of the hemp industry and learn the celebrations, challenges, and discoveries from hemp leaders and advocates from around the world. I'm Rebecca, International Business Officer with the Hemp Foundation, and your host. Today's guest, we have Abhishek Mohan. Abhishek has been part of Sunrise Industries his whole career. Over the last 15 years, he has been part of the online games, data security, venture builder, and fintech space, and seen ventures go from seed to public listing across Southeast Asia, India, and Japan. He is the founder and CEO of Hempstreet, which is India's first and largest research to retail venture in the medical cannabis space. The company is now in the midst of the largest rollout of medical cannabis clinics across India and is currently in over 9,100 clinics across 25 states. Hempstreet has also recently won the coveted big grant from BIRAC, the first medical cannabis company to win the same, for the development of a novel transdermal delivery technology for cannabinoids. Hempstreet is taking the fight to mass ailments, utilizing researched and responsibly dispensed cannabis-based medication. Abhishek, thank you so much for coming and being on our show at Hemp Foundation. We really appreciate, and admire the work that you're doing, especially me as a student of Ayurveda. I'm really happy to see, what you're doing in cannabis and Ayurveda together. So maybe you can start off by sharing a little bit more of your passion, your journey, your why you're doing what you're doing right now, from before Hempstreet to now.
Well, thanks for having me, and it's a pleasure to speak with you right now. And to give you a background, I've kind of been in the startup and scene from quite a young age, most seriously in Southeast Asia on video games and mobile security. Worked with incubators. I was a co-founder of one of the early incubators in India. And as this, went through this journey, we were quite heavily focused on healthcare. And the healthcare scenario in India is quite dire, especially around chronic pain. I was also quite moved by, I would say shocked by what happened with the opioid crisis in America. So me and my co-founders really saw cannabis as a way to tackle chronic pain and, avoid the repetition of the opioid crisis in India, which is actually looming. And we obviously found in Ayurveda, one of the companies we incubated was an Ayurveda network. And we understood that Ayurveda was the conduit, and Ayurveda has the richness of pharmacopoeia. All we needed to do was to take it through the scientific validation process, which we're in the process of, and then responsibly dispense it. And that's how Hempstreet came about.
Wonderful. So when did you guys start?
So as an idea, Hempstreet was around since 2018, but we started the company in 2019.
Awesome. Amazing. So from, what is your guys' main goals right now? I understand helping to solve this issue with the opioid crisis and pain and stuff. Can you tell me a little bit more about the products that you guys have and how are they currently helping people?
So absolutely. So I think we looked at mass ailments. We looked at ailments. We spoke to hundreds of doctors across the country before we decided on what products we would go after, what ailments we would go after. And we found out our first product was actually aimed, and still is, at menstrual cramps. There are 355 million menstruating women in India. 158 million suffer from debilitating menstrual cramps. So that's basically something that doesn't let you go to work, something that really very adversely affects your quality of life.
Yeah.
And there is no targeted, I would say, solution for it. There wasn't. People were taking a mix of pills that basically that you would take 4,000 times in your life. I mean, I don't want to mansplain, but for women, 4,000. If you're taking something 4,000 times in your life, it shouldn't be something that harms you in the long term.
Right.
So we found that was a very underserved section of society. It's half our population. Nothing was being done about it. So that's why we went first. And and then the second was gut health. And gut health is, again, in Ayurveda, what you eat is what you are, right? I mean, more
Right.
people realize that now after COVID, that wellness and symptom suppression are two different things, right? Are you really well, even though you feel okay? And I think that was the second. And we've had a significant amount of success, actually. Today, we have a product on shelf in over 9,000 clinics in 25 states in India. We've shipped over 4 million doses of our menstrual cramps product. We've
Wow.
seen very good reviews where, you know, we've had a lot of women write to us and give us feedback that their quality of life has changed. We will always be about mass ailments. We do have 4 or 5 other mass ailments that we're looking to tackle with, with Ayurvedic cannabis-based medication.
Mm-hmm. I really appreciate your approach, not just putting it out to the marketplace, but putting it out through the doctors, right? Through the Ayurvedic practitioners, because that is so very important, because each person is very unique, and Ayurveda is, client-centric, as we would say in the West, to really help the person for where they're at, right? Because everybody is unique and has different root causes of even the pain with menstrual cramps, right? So it's very important that somebody would consult with an Ayurvedic practitioner to make sure that they get what is the right dosage and everything for them. So tell me a little bit more about, the network of doctors that you've been able to bring together.
Sure. So we've, one of the things we always said was that if something was of a medical nature and it was provided as a medical solution, a medical practitioner had to be, taking the call. So we don't do patient marketing. We don't do all these campaigns. We heavily rely on our doctors to make that decision. Sometimes the doctors decide that cannabis is not for this patient, and that's the doctor's decision. It's not, kind of a pill mill scenario. It took us quite a while to basically, speak with doctors all over the country, gain their trust and tell them that this is a solution that we're providing, but it's completely up to the doctor. So, our network is across the country in 25 states. About 9,000 clinics now have our product on shelf. We don't follow, I would say, the pharma model. We don't try and push as much product as we can to our doctors. We, like I said, our doctors took a while because we were the modern, having the history that cannabis had after the NDPS Act and the illegality and everything. We took an extra effort to make sure responsible dispensation was something we would do from day one, even before the first tablet moved through from manufacturing to our doctors. We deployed a blockchain-based solution that we've onboarded all our clinics, all our doctor partners on. And that even today, all movement of our product is tracked in a something that we can't erase to keep it, honest. We also have an immediate understanding if a doctor is excessively ordering, which hasn't happened so far, which is amazing. But once we did suspect, and we obviously, checked, and it was, we were wrong, and that was good. So we are very, very strict about the fact that this, anything that's going out to try and replace or avoid people using opioids should not be like opioids. You have to do what was not done before. Responsible dispensation is one of those things.
So what has been some of your guys' biggest challenges, to date through this, and how did you overcome that?
I think it was basically to resist the urge to just go to market, to build, to have the discipline to build a structure for the long term, have the discipline to forego the low-hanging fruit, and understand the regulatory environment. And when we did understand the regulatory environment, we realized that India is one of the few federally legal countries in the world for medical cannabis, except that it's under Ayurveda. And there is an absolutely legal, federally regulated, nationwide regulated method to deliver the solution that patients need. So I think that was one of the things that took some time for us to understand, and we took the time. And the second is, again, coming out of a history of one generation before us that, was just told that it was absolutely illegal, to basically come out and win the trust of patients, to win the trust of doctors. I think that was that was something, a challenge we took upon ourselves.
Yeah.
And I would say one of the big challenges was to do the right thing, I would say, by, I would say, not being greedy.
Yeah, taking your time, being patient with the process. That's
Yes.
always the challenge, right? For us entrepreneurs who want to make things happen and make them happen quick is,
Yes.
to honor the process and to do things the right way too, because that's always the best for the long term.
And to understand the medicine and cannabis for what it is, I think because in the last 10 years or so, there's been a massive amount of capital that's gone into CBD and, kind of a recreational offshoot of that's now becoming medical globally. So rather than follow that trend, we looked within to see what was in the pharmacopoeia of Ayurveda. How could we take that across the scientific validation process? How could we bring it to the 21st century?
Mm-hmm.
We didn't need to reinvent the wheel, but resist the temptation of following a very recent development that even today, the world is now waking up to polyherbal and natural and holistic. And to keep that discipline while everybody who's abroad was raising a ton of money on a very simple business model, which that was one of the challenges too, like trying to, chart a path that hadn't been charted before anywhere else in the world.
Right. So what is your guys' vision, within the next 3 to 5 years? How do you see the growth of medical cannabis and Ayurveda and for you personally, and then for the overall?
So I think we would like to change the quality of life of at least 400 to 500 million people worldwide, I think, over the next 5 years. I mean, via the intellectual property that we come up with, via the formulations that we have, via the dispensation method that we have, and via all the conversations we're having across the world. I think the key is the cannabis industry is one chance that we can actually do things right. It's new.
Yeah.
People in it seem to want, be in it for the right reasons. It's just that we shouldn't, and always keep, I would say everybody should remember that we're here to help people, to keep the patient first, to understand that the doctor is the conduit, to understand that cannabis is in Ayurveda, it's one herb. It's a very important herb, important plant, but it's one plant. It interacts with various other plants to deliver the intended medical benefit, and it performs a function, sometimes as an anti-inflammatory, sometimes to relieve stress, sometimes to sleep, depending on what formulation it's in. So I think based on what we have in our culture and history, and based on the scientific validation process, I think there's the potential to, I would say, change the world. Right?
Yes.
And that's what we want to do.
Maybe you can explain, because I understand from the Ayurvedic perspective, but maybe you can explain to the audience or other people, what is the difference between just taking a CBD oil with the many different strains versus the synergistic effect of looking at the plant from a holistic perspective and including other herbs from that also help to support, or even including the entire plant, right? So maybe you can talk a little bit on that for people who don't quite understand the Ayurvedic perspective.
Yeah. It's basically in India, in the legal realm, and in Ayurveda largely, it's the cannabis leaf that we use. And again, if you look at our menstrual cramps product, it is the actual cannabinoid, the major cannabinoid content is not very large, but when it interacts with the other herbs that are part of it, it unlocks the anti-inflammatory, effect. Now, why this is important is that if you look at some of the other trials around menstrual pain that are going on around the world, they involve dosages of up to 320 mg of CBD twice a day. The idea is you should be able to alleviate the pain, but still function, right? I mean, that's
right.
So the idea is, I mean, CBD, I've said it before and I'll say it again. I think CBD rose to importance as a commercial decision. CBD is, it does have its benefits, but I think the idea was in the US, it was legal to grow hemp in all states, but cannabis was restricted. So CBD was the common denominator. While it's useful, it's, you cannot ignore the entourage effect. I mean, just because you've researched about CBG or CBD or THC or THCV or Delta 8 or whatever else, I mean, as you discover more cannabinoids, it doesn't mean that there is no role of the other cannabinoids that you have not, or the terpenes or flavonoids or whatever that you have not yet researched. Just because you found something doesn't mean it is the most important thing. And in Ayurveda, that's why the full plant, and the leaf powder there are 280 different formulations in Ayurveda for very specific ailments. Now, there's two ways to handle this. One is to say, okay, it's legal, we'll just go out and prescribe it. The second is to try and take it through the scientific validation process. Now, if you look at the cannabis industry globally, you had billions of dollars go into it, but the innovation has been quite little, right? I mean, you've had one or two intellect IPs created. You've had a lot of talk around CBD or different dosages of CBD, but it's still wide open, right? Now, when you have this vast pharmacopoeia in Ayurveda, all you need to do is take it through the scientific validation process, which is something that's very important. So why would you want to, I mean, there is cutting edge research that people are doing, we are doing around, Western style transdermal delivery. Israel is doing extremely, advanced research, but you have this ancient wisdom. And once you take it through the scientific validation process, then it's not this, there's no question about efficacy, right?
Right.
But the main principle is that there was a rush to create a cannabis industry where cannabis was the centerpiece, primarily because of the recreational, I would say, but the fact that something was illegal, now it's legal. But and as a result, cannabis needed to have its own thing. But in Ayurveda, cannabis is extremely important, but it is one of many other herbs.
Right. Awesome. Well, yeah, I mean, just so maybe you can go on to explain a little bit more of what you see for the future, and how can we get people to understand. I think you've done already a lot of work in educating the people and then providing the solutions, right? That's important too. But how do you see that we can continue to grow in this area?
Absolutely. So I think, one of the good things about what's happened in North America is that it started off with the recreational kind of focus. So it destigmatized, right? It basically took the illegality out of it. Mm-hmm. So as a result, when doctors will prescribe it, people are more receptive to receiving it. In India, on the other hand, it was made very illegal, and recreational is still very illegal in every state. So as a result, we did not find it. We knew that the doctors, especially Ayurvedic doctors, have a certain level of trust they have with their patients. Some of them are second generation.
Right.
So we knew that the doctors were really the best people to explain this to people, because they were not given saying, here's cannabis. It was a solution to an ailment that they have as part of a polyherbal formulation. Mm-hmm. So just the fact that we've scaled the way we have, the doctors, we laid our trust in the doctors, and the patients have trust in doctors. And that's kind of how it worked. And after COVID, people, like I said, have taken a new idea of what wellness means, right? I mean, right. You could, like I said, you could be a rich diabetic in the US and take maintenance medicine, and you don't feel like anything's wrong with you, but then COVID comes along and you fall very sick.
Yeah.
And so the idea of symptom suppression that over the last 2 generations we've gotten used to is pop a pill to forget about what's happening to you. Same with pain, also with menstrual pain. We work towards management of that pain, not complete alleviation, because pain is an indicator, right?
Right.
So as a result, we've gotten so used to popping a pill to forget the symptom, we don't realize what the underlying issue is. But a lot of people now that's why Ayurveda is getting very popular in North America. It's getting very popular around the world, because people want to be well. Wellness is an ongoing process, and in wellness, natural will usually always win, right?
Right. And Ayurveda really emphasizes balance, right? And our body has that natural ability to balance itself, but we get out of balance, and maybe we take, like you were saying, a drug that's covering the symptoms, right? But it's covering the symptoms, but then it's creating imbalance in other areas of our body. So I think, the Ayurvedic approach is to have for the doctors, right, to help the client to become balanced. And if cannabis is something that can help, along with the synergistic of effects of other things and lifestyle and behavior and all those other things that go into it, right? And I think, like you said, that people are waking up more because of COVID and looking at stress, because stress is one of number
Absolutely.
one things. And then that's a cause of pain as well, right? So, I really appreciate your approach, and I thank you for the work that you're doing.
Thank you.
Is there any last things that you want to say, or anything, that you want to share? Or
No, absolutely. I think there's a lot of help people need in developing countries. I would say a lot of ailments that we're going after are ailments that basically destroy your quality of life right at the onset. Don't give you a fighting chance. So I think if anybody is looking to get into the industry, anybody is working around solutions for some of these mass ailments, feel free to reach out on LinkedIn. I'm happy to give advice to anybody. This industry needs to grow.
yeah.
And more people need help today. So I think I'm absolutely happy to share with anybody, talk to anybody about anything if it gets these solutions to market faster.
Amazing. Thank you, Abhishek. I appreciate your time.
Thank you.
Thank you.
Thank you for listening to Hemp Foundation Talks. Hemp Foundation is a nonprofit social enterprise on a mission to provide solutions for our current ecological crisis. Hemp Foundation and their brand Uki has created a value chain from village farms to the marketplace, utilizing the many benefits of hemp to overcome deforestation, fight plastic pollution, and support regenerative practices to heal our earth. The foundation supports over 250 small village farmers in the Indian Himalayan region. In addition, they employ widows and women in the production of over 500 hemp products for the marketplace, from clothing to food to hemp bags, a large range of textiles, embroidered fabrics, home goods, and even hemp bioplastic. To learn more, visit hempfoundation.net.